Good evening and welcome to another episode of HealthWise. My name is Dr. Monique Lescott. I am your host for this evening's episode in collaboration with the St. Kitts Nevis Medical and Dental Association and ZIZ. Again, I welcome you, all you guys out there in TV land, internet land, radio land, and whatever form of other media outlet that you're viewing or listening to this program. I have here with me the lovely Karen Crossman, Executive Officer in the Ministry of Public Infrastructure. Good evening, Ms. Crossman.
Good evening. How kind of you.
It's really an honor and a pleasure to have you on this platform.
Same here. Thanks for having me.
Okay, and our topic for this evening is menopause. Hormonal changes and what to expect. Now, this is a very timely topic because I've noticed there's so many women out there, they want a space, a safe space,
yes,
that they can discuss these changes because it affects everyone.
Mm-hmm.
And we want to open the floor, well, maybe not so much so on this platform for that sort of feedback, but yes, we want to start the conversation where this topic is concerned. So welcome again.
Thank you.
So I want to ask you, as a lady, a regular working lady, what is your concept or meaning of menopause?
Well, for me, it's the simple part of it is that's when your period stops. And when I go into my research, they said after 12 months and you have no period, then you're definitely in menopause.
Yes, sir.
I figure that there is a leading up to, and probably changes are happening in your body, and you never recognize it. I'm in the
perimenopausal stage.
So those are two different aspects of it, and yeah, I'm in the latter part of it. I'm in menopause stage.
Good. So even in the perimenopausal stage, you can experience some of the menopausal symptoms,
Yes,
but it's not going to necessarily mean that you're fully menopause. That is one thing that we sometimes overlook. So it's actually very still possible for you to become pregnant within that year, that your period might have been irregular or you might be spotting, but you're still not in the clear. At least 1 year, 12 months exactly would have to have passed.
Thanks for telling me, doctor.
I don't think a lot of women know that. I think that's where we get the term, the oops babies. You think? So I'm going to go to the slides. So what we're going to discuss now, what to expect. Can we get to slide, what's that, 3? The other one. So what to expect. So I have here in front of me, we have
Hot flashes.
We have hot flashes. Just give me 1 second. The hot flashes is a big one. I think a lot of women associate hot flashes very heavily with menopause, but that's not the only symptomatic happening.
Yes.
with the pause. We have
Yes.
irregular periods, night sweats, trouble sleeping, joint and muscle discomfort, pain during intercourse, moodiness and irritability, forgetfulness, difficulty concentration, or a combination of all of these. What do you think? What's your take, your hot take on all of this?
Well, yes, when I first heard about menopause, you just associate it with, hot flashes. That's about it. I didn't know of anything else at all. And until I see it happening to colleagues of mine, friends of mine, and even family members.
Yes.
So persons would do their little research and say, okay, this is happening to me. I'm in that stage. Oh, this is why this is happening to me. And I guess a little more comfortable to know that, okay, I know what's going on with myself.
With your body, yes.
Yeah.
Okay, so I've also witnessed some family members experience hot flashes. What was not necessarily discussed though is the coping mechanism of it. Like, how do you cope with it? How do you remedy it? And is it something that can be managed? And it can, because they're triggers. They're triggers. So we're going to discuss those triggers further. We're going to go to the other slide and what to expect. We're going to continue with the what to expect. So your periods may no longer be regular. They may be shorter or last longer. You might bleed more or less than usual. All of these can be normal changes, but to make sure there isn't a problem, this is the part that most people miss, is to just, you go and see a doctor even if you're not sure, because it's not, I don't think it's the best idea to just assume that maybe, I guess some people might take these symptoms for pregnancy if you're active.
Yes.
But to make sure, if you know that you're of an age where genetically other women in your family might have had the pause around that particular point in time, I think it would be a wise idea to consult a medical professional.
Yes.
So,
well, it was about 2 years ago that my GYN had confirmed to me that I'm in the menopausal stage.
2 years ago?
2 years ago. And so I began to research, and I'm no professional, but I have a little more idea what's going on with my body. I'm fully now into menopause, but I had an idea what's going on with me, so I wasn't in any panic mood or confused, because I went and I read and researched.
Because it's funny you should say it was 2 years ago, because I've done a few readings myself, and sometimes what the experts have found is even if you don't go into full-on menopause right away, sometimes not even within 5 years, sometimes your estrogen levels start declining, sometimes as far back as maybe your late 30s. But I don't think they necessarily call that the perimenopause as yet, but your body is already preparing for the change, it's already preparing for the transition. So some women, I guess, if for efficacy reasons, if we wanted to prove it, I'm sure there are some women, their estrogen levels start to decline. Even
because everybody's body is different.
Definitely. So then you might also expect to have maybe closer periods in time periods together. I think that's probably very stressful to just be having a period back to back all the time. You may have heavier bleeding. You may have spotting after sexual intercourse or in between periods. Your periods may last more than a week. You may start bleeding or spotting again after not having a period for more than a year.
Yes.
That's very confusing.
Last one is for me. It is confusing, and then person will say that everything gonna blame on menopause. You know. But if it's happening to your body, then you know. And it's good for people to read and research and even to have a conversation.
I definitely agree.
It.
I definitely agree. We're going to stick a pin on this discussion, and we're going to take a short commercial break. We'll be right back.
Smart Electronics, your one-stop shop for all your electronic needs. Unlock cell phones, tablets, laptop computers, Bluetooth speakers, TVs, mobile accessories, memory cards, USB drives. We carry all major brands. Now you don't have to go anywhere anymore. Everything's available under one roof. Smart Electronics at Port Sante, opposite the food court. Telephone 466-4271. Visit our website at dutyfreesmartelectronics.com. Smart Electronics, way to live a smart life.
The stage is set. The spotlights are on the contestants, and the mic, it's hot. It's the ZIZ Kitchen Superstar 2025, the island's biggest and most exciting sing-off competition. Coming to you live every Thursday at 8 p.m. on ZIZ Television and across all ZIZ social media platforms. Each week, the performances gets bigger, the voices get stronger, and the excitement reaches new heights. Follow the drama, the emotions, the music as our stars chase the crown of Kitchen Kittitian Superstar and the Void Elimination. Tune in every Thursday at 8 p.m. on ZIZ Television and ZIZ social media platforms and cheer on your favorite contestants. ZIZ Kittitian Superstar 2025. The journey to stardom.
And welcome back. This is another episode of HealthWise. I am your host, Dr. Monique Lescott. I am here with my very lovely guest this evening, Miss Karen Crosman, executive in the Ministry of Public Infrastructure. And our topic for this evening is menopause, hormonal changes, and what to expect. So we're going to continue our discussion. So when we took the break just now, we wanted to clarify exactly when does the perimenopausal phase begin. And as I was suggesting, you can have hormonal changes as early as in your 30s. What was the time period it was saying? Between late 30s into early 40s, you can start having changes. So I'm guessing if you're having hormonal changes as early as in your 30s, you can probably have changes in your mood swings even as early as then, and you probably wouldn't realize that it was because your body is preparing for the change ahead.
That's the general consensus that we just came to, right? Probably was going through it and we didn't even know.
Yes, that's very interesting.
Because you're young and...
So, really? So then we cannot no longer blame, oh, she's having PMS or she's having a monthly cycle. Maybe she's just perimenopausal.
Right.
Okay, so we're going to continue the discussion. So what to expect, we're going to discuss briefly about hot flashes. So I'm going to tell you what the textbook meaning of hot flashes really is. It's, and it also coincides with night sweats, also called the vasomotor symptoms. I don't remember what slide this is. David, can you find this slide? So a hot flash is a sudden feeling of heat, most often in the upper body and face. Your face and neck may become flushed, red, blotched. Blotches may appear on your chest, back, and arms. Heavy sweating and cold shivering can follow. Night sweats are hot flashes that occur during the night and may disrupt sleep. Most hot flashes last between 30 seconds to 10 minutes. If I didn't know any better, this sounds like dengue fever. What you say? You have flush, like blotches on your is this like a dengue fever rash?
On your chest, back, and arms.
Why does a woman have to go through so much? So then how come when we were beginning our menstruation, it wasn't all of this drama, but for it to cease to exist, we have to go through so much?
And then one of the things that we spoke about was the fact that we were never told
what to expect
here. Mm-hmm. But our parents probably wasn't told either. What to expect at this stage with menopause.
And one thing I need to really highlight is what I was mentioning before is we associate menopause with the aging female, a woman that is no longer fertile or a woman that can no longer have children. So we associate that with a person that is aging. But I would like you guys to know that that's not always necessarily the case, especially these days where we have so much persons that suffer with cervical cancer and cervical issues where they have different pathologies that warrants the removal of your ovaries. And once you remove your ovaries, you're going to have menopausal symptoms.
I think this is interesting because I spoke to women who did not know that if you have to have
a hysterectomy,
the hysterectomy, that you're going to be automatically you're gone into
menopause.
Menopause, yeah.
It's going to affect
it
affects your. You can have hot flashes. It can affect your skin, your bone density, because all of this is what the hormones regulate once you're having a menstruation. So if you're going to have a hysterectomy where those the ovaries are not present anymore to produce that hormone, you can be 30 years old and you're going to be experiencing menopausal symptoms. And I don't think we speak about that enough, but we have so many women that suffer with fibroids, PCOS, cervical cancers, and different cervical issues that sometimes, like I say, warrants them to
have a history.
Yes, and we don't talk about the psychological impact enough of a young woman being thrusted into menopause. I guess I would say like sometimes 20 years earlier than the body was probably planning to. And I think that's something that we should really try to look into. We have to be our sister's keeper.
Yes, absolutely. I'm for that. And it's funny that you said that, because now I think that I could say that women want to speak about it.
No longer it's a shame.
It's not a shame thing, and I think in a comfortable setting. I mean, different atmosphere in the gym, in the church, at work.
Especially in the church, surprisingly, a lot of the women's groups right now are born out of churches. We have a lot of the aging population that go to church, a lot of them women. And I've been approached from a lot of different church member groups to speak on the topic. So there is an open forum and a willingness of persons to discuss the topic.
I'm happy to hear that, because there are a lot of persons suffering in silence with menopause. The symptoms, and you as the doctor would know, you're the expert, that they're not symptoms to be kidding about, joked about.
Or to be ignored
because
either.
It's some serious issues.
So we're going to go to the next slide. Hot flashes, risk factors, and triggers, because this is a condition that can be managed. You don't have to just, I don't know, boil in silence, because that's what some of my aunts used to do. When the hot flash came on, they just basically, I guess, used to endure it. I've never really seen her or seen any of my older relatives do much to try and alleviate it. It's like we'll be hanging around looking at TV, and then a hot flash comes on, and it's like she just tries her best to fan it away, air condition it away, and it never works. So we're going to talk about the risk factors and the triggers. So the health risk factors, as we see here on this slide, is obesity, and we've been tackling our eating habits even outside of menopause, and when it comes to our NCDs and stuff, our lifestyle has to change.
Tell me about it.
We have strayed.
I will do that.
Yes.
You and I in the gym.
Yes.
And we fall off. Fall back.
It's so funny you should mention this, because you don't have to let yourself reach to obesity at all. As long as you try to control your body, basically, even before perimenopause, I think you might stand a chance of curbing some of this.
Yes.
Right? So then obesity is one, smoking, your ethnicity. From what I understand, black women, in comparison to Asian and Caucasian women, we suffer way more. I think they said 10 times more with hot flashes than Caucasian women. I'm not sure why that is, but it's not fair. I just want to say that part. So physical activity. So then it's important to get your exercise in, your steps, have walks if you can't afford, or if you're not physically able to join a gym. It doesn't have to be anything strenuous. I always encourage persons, even a half hour a day, 30 minutes per day, should significantly curb a lot of the issues. And then we have stress and anxiety. These are all risk factors. So we have also the triggers. Smoking, again, is another trigger. Warm environments. Well, we live in a warm environment.
Yes,
but I don't know out there how my women who are actually currently going through menopause how are they coping?
They coping. You have you see them little fan people buy, you cope with that. You have all kind of ways to just try to keep cool.
I guess just the air condition.
In the air condition, if you're working in AC, whatever, even you in the AC, you feel hot. So you're fanning.
But one thing I had to kind of monitor one of my older aunts with, because sometimes some women can go into menopause quite late, and she used to sweat quite profusely, and so I think I had to help her to manage her salt. Because then if she's sweating like that, she's going to lose a lot of salt. So even stuff like that, you have to be mindful of in an environment like this where you're probably already dehydrated. Most of us are. Even if we sip water throughout the day, I find a lot of the patients, they're I will not say naturally dehydrated, but our lifestyle, the climate, lots of persons are always dehydrated. So then to add menopause and hot flashes and then to be sweating profusely along with it, I think is something that we also need to be mindful of.
Yes, okay.
Right? And so also binging and binging on stimulants like caffeine, well, I'm guilty of that.
I don't have a problem with coffee at all.
Really?
A coffee drink?
I love coffee. So because you told me you didn't really have much symptoms transitioning with the flashes, so you just had easy sailing.
And easy sailing and just becoming just very forgetful. That's what. They call it brain fog. That's what's happening. People think that you're just making your own diagnosis, but these things happening, and it's not because I'm reading, but you're experiencing little things. And I think that I am somehow getting off easy because people have real issues, real problems.
Definitely.
Honestly.
We're going to stick a pin on this discussion and we're going to take a few messages. We'll be right back.
It's time that we realize that we must work together to thrive. The world as we know it, the sky and below it. Could I never have more wonder? Yeah, with life and all you see and the climate's changing.
But hope is remaining.
And we can't ignore the future. It depends on you and me. One chance, all that we got. One voice, together we start. Take care, the world where we live. Permite a todos vivir. Tomamos la oportunidad para cortar la humanidad. And I must leave no one behind because we are one climate, one Caribbean. One climate, one Caribbean.
Good evening and welcome back. My name is Dr. Monique Lescott. Welcome to another episode of HealthWise. Our topic for this evening is menopause, hormonal changes, and what to expect. I have with me here my lovely guest, Miss Karen Crossman, Executive Officer in the Ministry of Public Infrastructure. We're going to continue our discussion. We were talking about hot flashes and the risk factors and triggers, and now we're going to talk about the prevention and management. So we're going to look at that slide. I like the illustration. It really explains what we're trying to convey here.
Yes.
So in terms of prevention, because I know Ms. Crossman, you've always been a very physically active person. You work a lot. So I suspect that was probably what helped you to curb some of these really awful symptoms.
I really don't know what it is.
Or
but
good genes.
Well, I have good genes.
Good genes.
God bless my grandmother.
Good.
But you try to, I'm in a group of 6 women who we try to
motivate each
be
other.
motivating each other in our physical activity and also in our intake, right? We start off in the month of October, say we're drinking, having no sugar or whatever. By the 5th day, I think everybody done jump off the wagon, but these things happen. You just have to just gradually just take it day by day and just try to motivate each other, you know?
I suspect for females that may have picked up the habit of alcoholism, I think trying to curb alcohol intake during menopausal transitioning, I think would be a kind of difficult for some.
It would be. I'm not a drinker. But there are persons who just casually will have a glass of wine
Yes.
at night.
Or beer.
I don't think that
should
would be a problem. Do you, as a doctor?
I don't think so. But do we usually just have one glass of wine though? Like,
No.
I don't. I like wine, and I'm not going to try to sit here and act like I only have one glass. When it's time for me to have wine. So that's why I'm thinking, for me, even right now, for me to try to curb certain social habits. I think it's something for me to really sit and.
Yes, that's it. When we are accustomed to doing things, it's very difficult to just
habit of
flip a switch and just cut.
And one other aspect that we totally overlook is the mental health aspect of it, because some women, because think about it, menopause naturally causes anxiety in some women because of the hormonal change. So if you were already a person to maybe be a bit alcohol dependent to soothe your nerves, so now your hormones are now
turn it off.
Not as balanced as they used to be, and now you have to. This doctor Lescott is asking you to secede from drinking. And it really causes a stress and anxiety and plunges some women into depression.
Yes, I think that is when I became serious about even reaching out to others, because of information that I had received about the mental health aspect of this journey. It's not good, and people suffering in silence. That is when I became serious about it and wanted to reach out to help. I'm no expert, but based on what I was going through was nothing in comparison to what other women
Did it
going
disrupt
through.
your sleep at any time? You had any disrupted sleep patterns?
Me, Karen Crossman, I'm not a sleeper.
You're not?
My family will tell you that. If I am going to, I will sleep a half an hour after the show wrap, or we go out, I will sleep. My family and my friends will tell you that.
I would believe you. I see you on the snaps. I see you on the snaps, and I'm like, this lady has a lot of energy.
True. If I'm gonna go down to sleep, I'll sleep. But you'll never see me sleeping like all day. Something has to be wrong with me. That's not me.
I don't think I've even seen you sit. I think this is the first time I've ever seen you sit.
All right, Monique.
But yeah, like the mental health aspect of it is an issue, though.
Yes,
because I feel like sometimes we're very dismissive of women. Sometimes we just pass off everything as maybe we're too emotional. But sometimes I think there's some substance to why some women might act out, why they might end up in relationships. This is a serious thing. Sometimes it ends up in relationship issues.
Yes, somebody said that to me just last night.
It affects like your sex life if you're married, or if you have a serious partner. It affects your sex life. It affects your relationship with your immediate family members, maybe your children. If they're accustomed for you to be jovial and now all of a sudden you're withdrawn and irritable, it affects the people around you.
Yes,
So
I've seen that. I've seen it.
I think an eye-opener needs to definitely be put out there so that we can be less judgmental and a bit more compassionate towards just anybody that we might see acting differently.
Yes.
Because, the mental health might be at stake.
I have that hat on now, that I have a listening ear for persons especially who's suffering.
Really?
Yeah. Mm-hmm.
That's good to know. So I can tell everyone to come and talk to Karen?
I'm no expert. I just said I have a listening ear.
But a listening ear is good, because I think it's important for us to have a village. Women need a village.
Yes,
I think men need a village too. I'm not trying to sound biased, but women need a village.
Yes.
I don't know if we still have a village. Do we still have a village?
I have my village.
I have one too, but I wonder if everybody else is as fortunate. It's
Well,
very
we prefer them that they have the villages.
So we're going to talk about the prevention of hot flashes and the management. So what we see here on the slide is diet is a big one, lifestyle changes, and curbing certain habits. So we have, do you have a particular diet that you subscribe to?
Fruits and vegetables. I'm not a vegetable person at all. I'm no pretender. I don't like certain vegetables. But they were saying that beets are good, carrots are good for what we're going through, celery, and like cucumber, those cool vegetables, cooling the blood vegetables.
So then it's not adding to the heat of the body.
Right.
That makes sense. And then you already mentioned that you exercise quite religiously?
Yes, I exercise.
Every day?
Yes. Well, let's say average 4 times a week.
That's still very awesome.
Yes. But then what I think is our problem is cravings after you done sweat exercise. Cravings. Those things cannot be denied. You have to make yourself very, very conscious that I'm not going to have this. I just don't work hard.
What's your guilty pleasure? Sugar?
Sugar.
You have a sweet tooth?
Just for like local drinks and stuff. I don't have to have like chocolate and stuff like that. And I can have tea, just hot water and the bush, hot water and a tea bag.
Okay.
But yeah, local drinks are my
That's
weakness.
that's your weakness.
And
so
it's bad because it's sugar. It's sugar.
But I guess a little guilty pleasure here and there because you exercise and you eat properly. A small guilty pleasure here or there wouldn't hurt.
Don't encourage me here.
And then we have some habits that we can curb in order to prevent and manage hot flashes, like smoking, drinking alcohol.
We were just speaking about that.
Yeah.
And so the sugar.
And excess sugar.
Yeah.
And caffeine. No, I'm very much a caffeine junkie. I would guilty as charged. I do love me a latte. I love the coffee shops, but now I know I have to curb down on having caffeine.
It's interesting information, though.
Yes, and then we have supplements that you can take to mitigate some of the symptoms as well. We have iron supplement tablets, omega-3 fatty acids tablets, and zinc. Zinc is always a good one to
I'm
have in your
surprised I haven't
arsenal.
seen this
And
magnesium.
one more thing, magnesium and vitamin D.
Oh, okay.
I don't know why it's not here, but
Okay.
And then for the management, identifying triggers, getting the appropriate wardrobe, cooling off with the shower, and of course, hydration, drinks. So most women begin the menopausal transition between the ages of 45 and 55, but as we already discussed, the dip in the hormone, the changes can occur at least 10 years prior.
Yes.
Right? And the process may last for several years. Women reach menopause at different ages, and the average age of menopause is 52 in the United States.
Yes.
I don't know if it's the same average in the Caribbean, but this is what WHO.
What would be the difference, though?
Demographic, I think they have 4 seasons. We have more of a hot climate down here.
Okay.
So,
Makes sense.
So then during the menopausal transition, the body's production of estrogen and progesterone, 2 hormones made by the ovaries, declines greatly. So that is what I was saying. Those 2 hormones being ever decreasing in your bloodstream causes more unstable moods, and I guess what they're saying is some people, I didn't put on the slides about hormonal replacements, but
I've heard about that too.
Can be an option, but it's not a one-size-fits-all for everyone. Depending on if you have pre-existing conditions, hormonal replacement might not be right for you.
Okay.
Right? But I've heard of instances where persons did it, or they've been taking hormones, which they're taking estrogen and progesterone, like a synthetic version of that, so that they don't experience the menopausal symptoms. So then they don't have the brittle bones. The bone density does not decrease. Like it helps to mitigate all of that.
Okay.
But it's not, like I said, it's not a one-size-fits-all for everybody. And so the symptoms related to menopause can last for between 2 and 8 years.
Wow.
Though the timing and symptoms are highly variable among women. So I think that's a very, very long time. That's
Very
almost
long.
a decade
I haven't read that.
to be in discomfort and to be unsure and to be anxious and and moody.
So only women have to go through these things, eh?
I'm hoping within that 8 years they're able to find coping skills and coping techniques to help them to mitigate, all of the symptoms that come
And
with
I think
the
part of the
pause.
coping is what I was talking about sisterhood, about groups, safe spaces, so that persons could get through it.
Because
I'm
it's a
not alone.
physical, it's telling me here now, it's both physically and mentally draining to endure. And I
Yes.
feel like that's a high contributor to why some women, they go through certain things in their later years. I don't think we remember menopause as maybe an underlying factor as to why their marriages might not be working out, why they're having stress on the job or stress with relationships with their children. I think menopausal symptoms might be an underlying factor for these struggles sometimes.
And I think that and those are reasons, I think, to extend grace.
Yes,
To
that is what I'm
women,
getting at.
Some women.
Some grace.
It's not an excuse.
No.
But just to extend grace.
And to stop being so
Especially-
dismissive. Because,
Yeah.
Where am I? So
Yeah.
during the menopausal transition, the body begins to use energy differently. And that's something that we have to consider as well. So then when it comes to even exercising, there are exercises called menopause exercise and hormonal exercises, I think I don't gatekeep. I'm going to share all of this knowledge with you women out there who are struggling with the bulge. You might just, because I've heard so many women complain that once they reach a particular age, the weight becomes way more difficult to lose. That's because you're doing it wrong. And you're probably employing the wrong exercises. Because what ends up happening when your estrogen and progesterone decreases, then you tend to increase in visceral fat, which is fat around your midsection. So if you were a young girl that was always accustomed to a flat midsection, and then after you start getting older, sometimes we contribute it to childbearing, but it's not always the only factor as to why you have a bulgy midsection. Sometimes
This is helpful. This is very helpful.
sometimes it's because the hormonal changes in your body, sometimes from what I've been reading, it slows down your metabolism, one, and two, your fat now is distributed differently. And your body is now utilizing energy differently. So there are ways I should have
And
put
you
it on
gain
the
weight more
slide. So,
easily.
yes, and so I should have put it on the slides there, and I guess I can advise you guys out there that's listening to Google it or YouTube it. There are specific training or exercise moves that targets your lower
I see that
midriff
on,
region.
yeah, Facebook has that.
And even some exercise gurus, there are entire exercise regimen that you can put on every morning, and you get
You
your
just do that.
Yeah, you just do
a
that.
15 minutes also.
You will
every
find the
day.
hormone belly goes, the bulge goes, and it helps with some of the inflammatory. Some women experience inflammation in the joints and what's not.
Yes.
Sometimes.
And
You've had that?
Yes, and was told to just before you just jump out your bed, you just sit a few seconds, and then you get up and start to move around.
Really?
Yeah, a little help there.
Because a few weeks ago, I remember jumping out of bed, as you said, and I just have this thing, as soon as I wake up, I fly out of bed. I should not have done that.
You're the doctor, you should not.
I should not have. I thought I was younger than I was. That's all that.
But sometimes it's just us, eh? It's just like that. You just get up, and it could be that you
And
get
then
up quick to
one
do
false
something.
move, and my back was hurting me for the next 4 days. That's the difference when you
I've
start
learned that
getting
recently.
early, when you start getting up there in age. So the distribution of the fat changes in the body, and women may gain weight more easily. It seems to me, even if I just smell a whiff of KFC, it goes straight to the thighs.
Child, I don't even eat KFC.
They may also experience changes in their bone density, their heart health, body shape and composition, and physical function. And that's another big one where you actually end up with bone density issues. So it means you have more brittle bones. So it means if you fall or if you, for whatever reason, bump into anything, some women end up with fractures more easily. So you have to be more careful.
But since you're speaking about this, can you make recommendations with like vitamins?
Oh,
I
for
mean,
sure.
some people don't like to pill pop, you know? But and say, okay, why you don't just eat the vegetables that would be associated to one of the vitamins that you take in and the fruits and stuff. But
For me, what I take is I love I wouldn't, and this again is not necessarily for everyone. I take the turmeric for inflammation, and I would also take sometimes maximum strength calcium.
oh,
There's calcium. I think you can get up to 1,000 milligrams per dose, and so I would take that in, just as one of my supplementary intakes,
okay.
right? Calcium also helps to regulate weight and stuff as well,
Okay.
right? So it's a good supplement to add to your regimen along with vitamin D.
Yes. And by the time we finish here now, it's just like you're going to pop 8 pills. It's a money. I don't like to do these one-a-day things. I just like to be specific. You're taking that, the turmeric, you're taking the evening primrose. You heard of that?
Yes, that's
They say
a good one as well, and it even helps to slow down grain. I bet you some of you didn't know that.
Really?
Evening primrose, you can.
But like you said before, but you are the expert. I'm not a one size fit all for everybody.
For everybody,
you know.
So then, while menopausal transition may commonly be referred to as menopause, true menopause can't be confirmed, as we said before, until 1 year after a woman's final menstrual period. For that reason, a woman who does not want to get pregnant and who does not want to have a oops baby should continue to use birth control for at least one full 12 months after her last period, right? I just got a signal I have to take a short commercial break, so we're going
Guys,
to...
after that, I was just going to Google something and leave with that topic.
So we're going to come back and we're going to discuss this one more entirely.
Okay.
Every smile, every hug, every step our children take is a precious gift. For 50 years, vaccines have been the shield protecting those moments, saving 6 lives every minute around the world. That's 8,000 lives a day. Thanks to Vaccination Week in the Americas, 1.2 billion people have been vaccinated across more than 40 countries. In 2024, we celebrated 30 years without polio and reaffirmed our region's status as measles-free. But there's still more to do. For 2030, PAHO has set the goal of eliminating more than 30 communicable diseases. This goal is about caring for our future and for our communities, our health systems, and boosting socioeconomic progress. One of our top priorities is to become the first region in the world to eliminate cervical cancer, a disease that took more than 40,000 lives in 2022 alone in the Americas. To this end, PAHO supports countries in reaching at least 90% vaccination coverage rate for the human papillomavirus in girls under 15 years of age. Also, some countries are already vaccinating boys, which will help achieve the overall goal. But there are still children and adolescents without access to vaccines. We need urgent support from our leaders, our communities, and from each individual. No child, no one should suffer or die from a disease that we know how to prevent. Why is getting vaccinated essential? Because each person vaccinated is a life saved, a step closer to individual, family, and community development. Because your decision makes a difference. For those you love, for the future, for your health, and for the good of your country and our region.
Welcome back, guys. My name is Dr. Monique Lescott, and we have now almost reached to the end of our show. I have here with me the lovely Miss Karen Crossman, Executive Officer in the Ministry of Public Infrastructure. We have been having a very thought-provoking discussion, an interesting discussion on menopause and hormonal changes and what to expect. So we're going to continue our brief discussion before we recap and bid you farewell for the night. So as we were saying, Ms. Crossman, she says she has never heard the term of a oops baby. I've heard of it, a oops baby, because I've known of one or two.
menopause baby.
Menopause baby?
Yes.
Overseas they say oops baby, because so many women, they figure once they reach a certain age and their periods are now irregular, some of them, they slack up on the birth control, and then a little one becomes lodged in the oven, and then we're all happy for the bundle of joy again. So menopause can also result from what we were saying, we discussed before, the surgical removal of both ovaries. That's a total hysterectomy. If you have surgery to remove your ovaries and are not taking hormones, which is the hormonal replacement therapy that I was talking about, you will stop having periods and may experience symptoms of menopause immediately.
Wow.
Immediately. So that's what I was saying. For a young woman that, for whatever reason, she might have been ill and she has to have a hysterectomy to be thrusted maybe 10, 15 years before your time into menopause, I think has a psychological toll.
Yes.
I think that has to be rough.
Absolutely.
Because it's going to come with irritability and maybe disrupted sleep and stress and anxiety, maybe a bit of depression. I've not heard much people discuss that aspect of cervical intervention or cervical surgeries, because I come across them quite often. We discuss all of the PCOS, we discuss the fibroids, but we don't discuss, like for instance, when a woman has to remove both her breasts, we also know that's a big psychological change. But because I guess the ovaries are on the inside, we don't really figure that it's a huge transition, but it is. It's a big change to have to, live without your ovaries.
That must be really like terrifying.
Yes. And I don't think that's something you would even be thinking about unless you're put in that situation.
Could it be unless, well, this is what before it happens, then a doctor will tell you what to expect. Even so, you still can't handle.
Won't be like psychologically prepared enough to know what would exactly be the case once. So then after menopause, women are more vulnerable to certain health conditions. And that's something, again, that we don't speak about after the pause, when you're sure now that you're no longer seeing a period anymore and your fertility has now been a thing of the past. Now you have a new set of things to worry about. A new set of threats.
Just for women?
Just for being born a woman. So certain health conditions, including heart disease, now becomes more prominent, more becomes a risk. You become more susceptible to strokes, osteoporosis, and for those of us that would not know, osteoporosis is when you lose bone density, and so now your bones become more brittle, less dense.
You spoke about that.
Yes, so then if it is you happen to fall, you bump into anything, sometimes you become fractured quite easily from the slightest of any sort of injury. So you have to be careful, more ginger when you walk. So during this time, it is important to continue to eat a healthy diet, stay active, and get enough calcium and vitamin D for optimal bone health. So that would be the end of my presentation. So we're going to recap for those who might have missed the first segment of the show. I'm going to have you let the public know for me, what is your take on menopause?
Well, as I said before, menopause for me is when the period stops. And I have learned that it is when the period stops for 12 months plus. You're officially in menopause. That's what I have learned. But it's when it stops
Good.
permanently.
And so while you're going through menopause, it is normal to expect things like hot flashes, irregular periods, night sweats.
Trouble sleeping.
Trouble sleeping is a big one, and I think even if before some persons I don't think are good sleepers, even before the transition. So maybe sleep therapy might be an option for some of us.
Some people put on that, put on a YouTube channel and listen to the waves.
That's a good idea. Listening to like soothing sounds,
Soothing
nature sounds,
music
rain and waves, as you say, crashing. So then we also can expect things like joint and muscle discomfort. Some persons even have full-blown inflamed joints. And so instead of mistaking it or misdiagnosing your own self with things like, maybe even things like arthritis and what's not, it's better to just go to the doctor and get a full physical
self-diagnose
exam.
all the time. We're guilty of that. So.
And then some of us can experience pain during intercourse. Some of us also have moodiness, irritability, forgetfulness, difficulty concentrating, or a combination of all of these. And you were saying that you were susceptible to which one? The
forgetfulness.
The forgetfulness. And so what did you do? Do you take supplements?
What
ginkgo?
am I doing?
What are you
because
doing?
it's happening.
What are you doing too?
Yes, I need to get some ginkgo. But I'm just trying to focus on what I'm doing. That's why I have to pay special attention to what I'm doing. Like, I miss phone.
So you
I
can't
don't know where your phone
multitask?
is. And I'm a person that multitasks. So this is it. So I was like, what's going on here? Misplace your phone, you know where your phone is. You can no longer hide with things from yourself because you know remember where you put it. You can't remember where you put it. These things are real.
Oh my gosh. So then with the hot flashes and night sweats, also called the vasomotor symptoms, among the more common symptoms of menopause. So again, to reiterate and to explain, a hot flash is a sudden feeling of heat, most often in the upper body and the face. Your face and neck may become flushed, which I was saying, that sounds to me like dengue fever, eh? With red blotches may appear on your chest, back and arms. Heavy sweating and cold shivering can follow. Night sweats, hot flashes as well that occur during the night and may disrupt sleep. Most hot flashes last between 30 seconds to 10 minutes. To me, all of this sound like when a child teething, the only thing that missing now is a fever. Right? And I guess that's just one of the perks of being a woman.
We have to go through it, I guess.
So the risk factors of hot flashes would be things like obesity, smoking, and what ethnicity might be, whether you're black, white, or Asian, which they say Asian and Caucasian women are 10 times or 5 times less likely to suffer hot flashes than black women.
Okay.
I'm not sure why.
You were saying it has to do with where they are physically.
That's true. Especially, and Asian women, their lifestyle is different. They eat different too.
Yes,
they
so
eat different
true.
for sure. And so some of the psychological risk factors would be things like stress and anxiety. So some triggers would also include smoking, warm environments. Oh, I didn't even mention spicy foods, but I love spicy foods. I didn't realize that can trigger a hot flash.
I don't.
That's really bad news. Binging on stimulants like alcohol and caffeine and stuff like that can be triggers. So to prevent and manage, we have diet changes, exercise, and minimizing harmful habits, and to definitely
use supplements.
to have intake of natural supplements and what's not, and to wear loose clothing that dry easily, like that absorbs moisture easily to keep your body warm. Do you do any of that?
No. No, I don't. I've never experienced this hot flash,
And you said you're not an avid drinker of coffee or anything.
No.
So I guess because you didn't really have a life where you were dependent on stimulants and eating spicy foods like somebody I know. You,
I'm not a spicy food
you don't like spicy food either?
No, I don't.
I like all of the things that they tell me not to like on top of this thing.
But don't we all, in some way or the other?
That's so true. So that also brings me to some of my last points here. Most women begin menopause and they start transitioning between ages of 45 and 55, but we know that can occur sooner than that, and
Yes.
it depends on your genetics.
Yes.
But you have the good genetics, so you
Good
were
genes.
able to sail through. So
Probably going through it and didn't even know I'm going through it.
and I'm
Yeah.
supposing that there are a lot of women right now that are also unaware of what they're going through as well.
Yes, I hope that this reaches a lot of persons and they be able to feel comfortable in the skin that, okay, it's nothing strange. I'm experiencing something that other women
Yes,
has experienced.
and nothing to be stigmatized about.
Right.
Okay. And we mentioned that the average menopausal age in the States is 52 years of age, but I didn't research what age it would be in the Caribbean. And so during the menopausal transition, the body's production of estrogen and progesterone, the two hormones made by the ovaries, declines greatly. So that in itself is the essence of what causes all the problems in menopause.
Yes.
Right? So these two hormones, basically once your body stops producing this, it makes your bone density decline, so then you're more likely for fractures and less bone density as well. So this would mark the end of my presentation with you guys. I would like to thank you guys for listening and for tuning in, and I would also like to thank Ms. Quasman for stopping by and for sharing her insight and
Well,
her
thanks for having me.
experience with this very...
And thanks for teaching me a lot too. I've learned a lot.
You're very welcome.
And congratulations, Moni.
Thank you.
Yes.
So that's it, you guys, and thank you for tuning in.
Thank you.